Dr. Turnpaugh, Dr. West.
Yes.
Oh, hi.
We just had American Heart Month, but what about women? What about women and their hearts?
Oh, we haven't talked about women.
We haven't
this
talked
month,
about
huh?
women. And that's good because they're a completely different stratosphere, more complicated, as women are much more complicated than men. We should do a little talk on women's
Heart health.
So we're going to finish off the American Heart Month by talking about a subject that is very much underappreciated, and that is ASCVD, or cardiovascular disease in females.
So this is a topic that really deserves some specific and special attention, I think, because a little known fact, maybe it's a well-known fact, but heart disease is the #1 killer in this country and the world. And that includes heart disease in women, right? More women are afraid of dying of cancer than of heart disease, although the likelihood of them dying from heart disease is exponentially higher than them dying from cancer. Not trying to diminish, the cancer diagnosis and that fear, that's totally legitimate. But fact of the matter is, heart disease should be feared more than cancer. Good news is it's preventable. It's preventable in men, it's preventable in women. But you have to know you have it, right? You can't prevent what you don't know about.
And while we've done a pretty decent job of looking at the standard pieces like cholesterol and this and so forth, what we're finding is that in females, heart disease is actually growing in middle-aged women. So it's not decreasing, it's increasing. So we haven't solved that piece. And there's a whole lot more to females in cardiovascular disease than just the cholesterol piece.
In fact, just to pick up on that, heart disease is the fastest growing condition in middle-aged women between 45 and 64. So if you're in that age group, and we'll talk about this a little bit more later, kind of looking at menopause down the road, not too far away, heart disease is the thing you need to be aware of.
And many times, again, we acknowledge that the risks, and we've talked a little bit about this in some previous little blurbs about cholesterol, but in females, it's much more complicated. There are risk factors such as inflammation, there's risk factors such as stress, there's risk factors such as hormonal changes, which are very much different than the male. Males are pretty simple, their hormones don't change a ton, and one hormone that kind of declines with age. Females are very complicated. Their immune systems are much more sensitive, much more likely to have inflammatory cascades, which will affect their cardiovascular disease.
Absolutely. Inflammatory disease in general is more common in women, and we know that is one pillar of the cardiovascular disease risk, is not just the presence of high cholesterol or high LDL, but that in the presence of inflammation. And that's kind of the gasoline and the match combination. And in women, that inflammatory risk is significantly higher.
And as we live longer, we're actually noticing that women's rate of cardiovascular disease does mirror men's after menopause. It just takes a little bit longer. So if there's a 10-year delay, and those rates in cardiovascular disease are actually mimicking men. So it's not that men have the ownership of cardiovascular disease. Women share just the same.
But that's one of the reasons that delay is one of the reasons that maybe women's heart health has taken a little bit of a back seat. Men tend to have their event or discovery of their cardiovascular disease 10 years earlier, as you said. And if you think about it, so, average age maybe in the 50s as opposed to much later in the mid to late 60s in women. The coincidence of the development of cardiovascular disease has a very similar timing to the onset of perimenopause and menopause. So that brings in that hormone risk factor as another component aside from the inflammatory factor.
Yeah, without quoting a bunch of studies, there's extremely strong correlation between hormones and the decrease in hormones in females and the increase in cardiovascular disease. And it's also important to know that cardiovascular disease typically starts in your 30s or late 20s, and the event isn't realized until later in life. So it doesn't happen, as we say, as a bump in the night. This happens over time, and then when that whole perfect storm is exacerbated, whether it be through menopause or through an inflammatory cascade or stress, that's when you realize the event. But that has been coming like a snowball for 20 or 30 or 40 years. So it's really important to identify the risk factors, which are multifactorial, more so in females than in males, to understand all of your risk factors well before you get the cardiovascular disease.
Absolutely. So, as Dr. Turnpaugh said, that starts very early on. And it starts with lifestyle, long before we get into the hormone factor, although in retrospect, there can be implications for risk for cardiovascular disease based on hormonal factors such as the age at which you started your period or how old you were when you stopped having periods. Those all are incidentals that play a role, although they're maybe not the center stage items.
And to that point too, how difficult was your cycle when you were cycling? How difficult was perimenopause? How much stress? When your ovaries start to go into retirement, and then your adrenal gland has to pick up all that slack, and it's really your backup mechanism. It's not your primary mechanism. It's your backup.
Exactly.
And if the backup's already taxed from stress and all the changes that you went through, it's harder for it to regulate it post-menopause.
And that's very common. We see that a lot in women. The sort of life of chronic stress, which after a while becomes that woman's normal.
That's their norm.
With not even the perception of the degree of stress and what that is doing somewhat silently on the adrenal glands, which, as you say, are the backup to your ovaries when you stop having periods and enter menopause. So the ability of the adrenals to make up for that is greatly impacted by the decades before you actually are at the highest risk.
Yeah, so many times we think of, well, my cholesterol's fine. And that's not the full picture, as we kind of alluded to in some of the previous posts we put. It's more than cholesterol, but it's much more than cholesterol in females. In females, there's a lot of risk factors that you can start to identify long before the event would happen. So identifying some of these hormone levels, inflammatory levels, different physiological labs you can have done before menopause, during menopause, and postmenopausal, which are going to play a role in cardiovascular disease, which is the #1 killer in females. And in middle-aged females, it's growing. So clearly, if we had the answers completely figured out, it wouldn't be a growing phenomenon.
Exactly. So maybe we can talk a little bit about what happens when your ovaries are no longer functional and your adrenal glands can only go so far. And you start to develop the signs and symptoms of loss of estrogen, right? We all know them. We lose elasticity in skin and soft tissue. We lose health to our bones. We lose muscle mass. We lose sometimes some brain function. I can't remember where I put that, or the words don't come quite as fast. Those are all very subtle, but accepted findings and signs and symptoms of getting older, which can be affected by hormone replacement, aside from whatever your adrenals are able to do.
Right, and I think it's important that what the accepted level is not optimal, right?
Absolutely.
So women
we accept more than we should.
Right, we're accepting that this is, you had talked about, many females will accept this is just my stress level. It's not okay for the human body to be under that much stress, but if that's what you've been under for 15 years, it's your norm. And we also accept that when women go through menopause, they have accelerated aging, such as, again, the skin and the bones and the hair and the muscle. And if there's ways we could make a soft landing rather than a crash landing, and hormone replacement has been shown to be very effective in the healthy aging process. And healthy aging includes healthy cardiovascular disease aging.
Absolutely.
Yes.
We hear a lot of women who still remember the study from the early 2000s, the women's health study, that had some very frightening outcomes reported at that time. And women were taken off hormones, were afraid to ever start hormones. Doctors were afraid to initiate hormone therapy. But I don't know how well publicized this fact is, but we hear it when at the conferences that we go to. That study has been reinterpreted, shall we say. looked different. Let's look at the specifics of the study and what the outcomes are compared to what we do now. And the recommendations are quite a bit different now than they were then. So even though there remains a somewhat of a fear of hormone therapy, the risks are really much lower than I think met the eye with the original interpretation of that women's heart.
Right. That study showed that there were some risk factors for cancer and things.
Cancer,
but all of
heart
those
disease and
heart
stroke.
disease and stroke. Yeah. So it sounds like a pretty bad study, but when you go back and tease it out, they weren't using the type of hormone replacement you use. They were using artificial progestins. They weren't using regular progestins. So the hormones
oral
they were using, they're using oral
topical
versus topical. They were using equine estrogens. So if you look at, and that's basically been replaced with new studies that show if you're using bioidentical hormones and the right way, administered the right way, they're all protective. Now there are some risk factors, but not for cardiovascular disease.
Right.
But there are some risk factors. But if you know what those risk factors are, if your provider knows what those risk factors are, and Dr. West knows what those risk factors are, so you can get on a healthy hormone replacement regime without those risk factors, and it pretty much negates all the negative press of the Women's Health Initiative.
And we have so much more available now to monitor hormone levels and determine how your body is clearing out the hormones that weren't available in the past. So we definitely take advantage of that when we're treating someone with hormone therapy. It's not just here's your hormones, and if your hot flashes are gone, all is well.
And it's not a one-size-fits-all.
And it's not a one-size-fits-all by any stretch.
It's customized, yeah.
So we'd like to close our meeting with you today with a bit of a call to action for women to take a minute and think about what your risks are. You have family history, which definitely plays a role, and you can't ignore that. But also, what is your personal risk history? What have your lipids been like? Have you even had your lipids checked? What are your some of those advanced lipid markers that we know about now that Dr. Turnpaugh talked about in previous videos? What about your what is your hormone exposure like? When did you start cycles? What kind of periods did you have? If you're menopausal, what was the menopause like? Did you suffer greatly from a lot of hot flashes? Those are called vasomotor symptoms and are associated with more cardiovascular disease. What else, Chris?
Well, understanding your stress throughout life.
Stress.
So if you've had a very stressful life, that's going to play an impactful role. Stress is something we can't always get in a blood test, but we can look at inflammatory numbers, which can be reflective of stress. So, and hormones, we think of hormones in females as just female hormones, but there's a lot of hormones such as your thyroid hormones and other hormones that work in the body too. So looking at, I think the emphasis is for women, knowing your risk factor is much more comprehensive, more than just lipids. It's hormones, it's inflammation, it's stress. And if you can evaluate all those risk factors, which really should be done sooner than later, because this is a snowball that's just getting bigger. Let's not wait for the event. Used to be first event that someone had a 50% mortality rate, and now it's down somewhere in the 30s. But if your first sign or symptom is death, you should probably do something before then.
So we'd love to help you identify your risk factors and assess where you stand, and most importantly, how you can intervene to prevent being a victim of cardiovascular disease.